Good evening, I'm Dr. Twyman. I'm the biohacking cardiologist. I focus on heart attack and stroke prevention. My practice in St. Louis, Missouri, at Apollo Cardiology. Tonight we're going to be talking about how to actually take your blood pressure. So, blood pressure is something that occurs when your heart squeezes, the blood comes out of the heart into the aorta, the major blood vessel that takes the blood away from the heart. The systolic blood pressure, the top membrane blood pressure, is the first number, so that's the force of the blood coming up into the aorta. The aorta acts as a accordion essentially, and it expands when the blood comes in, and then it recoils. And so that recoiling keeps that blood coming out that is coming out each heartbeat. It keeps it more steady instead of just big blobs of blood essentially. And so you have a diastolic blood pressure, which is the bottom number on the blood pressure. So you'll see a blood pressure quoted as 120/80. So 120 millimeters of mercury is the top number, 80 millimeters of mercury is the bottom number. And you hear me saying the word millimeters of mercury because that's the kind of gold standard how to measure blood pressure is with a mercury cuff. And that's what I have in Apollo Cardiology, and it's just more sensitive at hearing those different blood pressure sounds when you have a stethoscope in. So blood pressure, is one of the 400 things when it's abnormal that can drive cardiovascular disease, particularly stroke. So, I've done previous talks on, managing blood pressure, but tonight I just wanted to briefly go over, how to actually take a blood pressure. So, the blood pressure varies throughout the day. I frequently talk about circadian rhythms, or your 24-hour cycles. Those 24-hour cycles are mostly programmed by the light that enters your eyes, hits your skin, and the timing that the nutrients come into your body. Your blood pressure also has its own 24-hour cycle. So you have a blood pressure trough or low at about 3 a.m. and then your highest blood pressure is generally about 9 a.m. and then you have a second peak about 7 p.m. And so to really accurately measure blood pressure, you should take it multiple times a day if you have an issue with blood pressure. But there are devices called the 24-hour ambulatory blood pressure monitor that the cuff is on your arm. You have a little battery pack that has the mechanism that fires up the blood pressure cuff, and it records your blood pressure 24 hours a day. You get a nice graph, and then you're looking mainly to see, does your blood pressure drop overnight? That is called dipping. Your blood pressure should dip by at least 10% overnight. If it doesn't, that increases your risk of heart attack and stroke fairly significantly. So taking your blood pressure, sorry to get off screen for a second, is you just want to make sure you have a bicep cuff to start with. The wrist monitors tend to be very inaccurate. So if you have something that's sitting on your wrist, possibly accurate, but you're going to take that into my office or any of your other physician's office and calibrate it against our mercury blood pressure device. But this is a air sphygmomanometer, hard to say sometimes, that you want to have a few conditions set up before you even put this on. Excuse me. So ideally, no alcohol for 12 hours. Nicotine should be out of your system for at least 6 hours. Nicotine should be out of your system for 4 hours. Caffeine should be out of your system for 6 hours because all three of those stimulants will cause contracture of the blood vessels and will raise your blood pressure. 60% of people are sensitive to caffeine affecting their blood pressure. So you may want to check your blood pressure, drink your caffeine, and then an hour or two later, check your blood pressure and see. If it's going up 20, 30 points, you may be very sensitive to it, and caffeine may not be for you. Then, if you really like the taste of coffee, go to decaf coffee. So set up the environment right. So you want to be seated, your feet on the ground, your back supported. Your arm should be at 90 degrees to your body and supported, either with somebody else holding it or resting on that table at heart level. The blood pressure cuff, again, should be a bicep cuff. If you have the skills and have a stethoscope, a manual blood pressure will give you the most accurate results, non-invasively. Previously as an invasive cardiologist, I used to feed catheters and wires up into people's blood vessels and monitor different pressures. That'll give you a very accurate aortic pressure and pressures inside the heart. You don't need that unless something bad going on with your heart. But non-invasively, you want to have a bicep cuff. Most over-the-counter ones, you'd have a sphygmomanometer. If you see me in the office, we use the blood pressure cuff, but it has a mercury dial, so like a old school thermometer, but we pump it up, the number goes up. We're going until we have a stethoscope. We're listening to your artery right here, your brachial artery. We're listening until we don't hear any blood going past the stethoscope, so you're silent. Then start letting the air out of the bulb. You start hearing boom, boom, boom. The first time you hear that sound, the Korsakoff sound, that's the systolic blood pressure, or the top number of the blood pressure. You keep listening until you don't hear it anymore. The second Korsakoff sound, that's the diastolic blood pressure. So you have a top number and bottom number, 120/80. There's something known as the pulse pressure. So just subtract this top number from the bottom number, and it gives you the pulse pressure. If you have a very wide pulse pressure, you may have aortic insufficiency, where the aortic valve doesn't fully close. And so a lot of times when the heart is squeezing the blood up into the aorta, the blood's falling back down into the heart. And so you have the blood pressures be very far apart. If you're very, it also gives you a metric of essentially, when I was talking about earlier, when the blood comes out to the aorta, it's like an accordion, it stretches and expands. If your aorta is very stiff, the blood pressure, pulse pressure is going to be abnormal. So I mentioned, you want to be seated, calm, no alcohol, no nicotine, no caffeine in your system, and, take it, early in the morning. Like I said, at 9 o'clock is usually your highest blood pressure, but you may want to take it, 2 or 3 times and average it out, because just one blood pressure doesn't make a disease. And again, I don't necessarily consider elevated blood pressure a disease. I consider it more abnormality in your environment or your epigenetics. Your environment is causing your body's endothelial function not to work appropriately. And I talked about that last week on my Instagram Live, was how to optimize your endothelium, the inner lining of your blood vessels. When the endothelium doesn't release nitric oxide, the arteries don't dilate appropriately. So, sometimes I get asked about, other blood pressure cuffs. I don't rep for any particular ones. I'm not an affiliate for any of them, but I do tend to like one of the Omron brand. Omron as a whole makes good blood pressure cuffs, but they do have a nice portable one that has a transmitter that will record it on your phone, and you can keep a nice log of it. There's also a cloud service that you can upload all your information to, and then your doctor can log on and see your average blood pressures over time. So that's what I wanted to share tonight, is how to optimally take your blood pressure, and I'll open it up to any questions. This one was going to be a short one. It's just short and sweet. Blood pressure is a big issue causing cardiovascular disease. I usually will recommend patients monitor at home, and just want to give a kind of a brief demo of what I would be looking for and how best to get accurate data at home. While we're waiting for questions to come in, so yes, there are numerous pharmaceuticals that can affect blood pressure. There's risk and benefits of anything you put in your system. I'm always going to start with lifestyle first. So exercise, deal with your stress, nutrition, sleep. Get those things optimized. And if blood pressure is still a concern, then we'll look at nutraceuticals and then pharmaceuticals if need be. The pharmaceuticals jump in more when there's evidence of in-organ damage. Your kidneys are being damaged, your heart is weak, your heart is stiff, you have diastolic dysfunction, you previously had a heart attack or stroke, could be more aggressive, likely to end up on medications at least short term. One thing I did not mention, skip my mind for a minute, was that when you do check your blood pressure, you should check it in both arms initially, and they should be fairly close to each other. If the top number is more than 20 points away from it, so if your left arm is 160/80 and your right arm is 140/80, you're going to want to take it in the arm that has the higher blood pressure. And you're definitely going to want to let your doctor know that you have a differential blood pressure. That doesn't mean necessarily anything is wrong, but they need to do a little bit more detective work. It can mean that there's a blockage in your subclavian artery, the artery under your collarbone, and that will affect your blood pressure being low on that side. Sometimes it also can be an issue with the nervous system, affecting how your sympathetic and parasympathetic nervous system work. If your sympathetic tone is really high, it squeezes down. So if you have a nerve issue going to that side, it might constrict that artery. You can also measure your palpate your radial pulses, right by your thumb, and you should be feeling the same kind of pulse. If it's weaker on one side, well, then that's kind of the evidence maybe that there might be a blockage in that subclavian artery called subclavian stenosis. And so, question, should blood pressure basically be the same day after day? Ideally, it should always be under 120/80. That's kind of what a resting blood pressure normally would be in mankind. I don't remember the details. I can't remember exactly where I learned it, but it was something crazy like a giraffe's systolic blood pressure is like 300, 400, because they got to pump it all the way up its neck. So in giant medical studies, looking at millions of people, they looked at where the risk really starts increasing, and about 120 over 80 is kind of the cut point, but like really 110 over 70 is where the risk starts increasing. So if you keep your environment consistent, then yes, your blood pressure should be similar day by day. But again, I talked about it is that I don't consider hypertension, or that's a medical term, an ICD-10 billing code, to be necessarily a disease. It's something in your environment affecting the blood pressure. So if you didn't sleep well, if you loaded up on caffeine that morning, went on a bender the night before, your blood pressure is going to be different on those days. Question, what's the best home device to use to monitor blood pressure? Probably your family member who's a cardiologist, but be honest, I tend to recommend the Omron blood pressure cuff. That's the Evolve. No affiliation. I don't make any commissions talking about it, but the Omron Evolve, I think usually about $100 or less. You can go on Amazon, or if you're in my office, I can tell you where to get a discount code for it. But it syncs up to your phone, records your blood pressure throughout the day. So the normal blood pressure, I typically will use the data from the SPRINT trial, that it really is 120/80. If you're advanced age and at risk of falling, maybe I'm not going to use the aggressive blood pressure target. Maybe I will use more 140/90. But the risk of stroke really does start increasing. If your blood pressure is consistently over 160, you likely should be on medications until they can figure out why your blood pressure is that high. The major risk of high blood pressure over time, and it just beats up the endothelial function of the arteries. And wherever there's high shear stress, plaque forms in those areas. So you got 60,000 mile blood vessels pumping this blood through. If it's at high pressure, things start wearing out faster than they should. Stroke is probably the number one thing, and then heart disease, or blockages in the coronary arteries. The issue with low blood pressure, that definitely can be an issue with people who are I would consider not necessarily over medicated, but sometimes if you really change up your lifestyle and eating clean, sleeping well, dealing with stress, possibly your blood pressure is going to improve, and you don't need as many antihypertensive medications, and so you wean off the ones that don't necessarily have the greatest data on morbidity or mortality. So anything you want to put in your system, you want to make it likely that you don't die, if you take this medication, meaning you live longer if you're on this medicine, or that you don't have a heart attack or stroke. It reduces events. There's certain medications that will lower your blood pressure, but they don't really affect your events. So you want to get rid of those ones if at all possible. But some people have naturally low blood pressures. I sometimes can rock some, mid-90 systolic blood pressures. I'm on no medications or supplements, but I'm not dizzy, I'm not passing out, so it's not an issue. So it's mostly symptoms. Dizzy, lightheaded, near passing out or passing out would be concerning if you have low blood pressure. Yeah, that's definitely for sure. I did not really go into the hormonal cascade tonight, but women, when they're on their cycle, they definitely will have fluctuating blood pressures. Some component will be, due to estrogen fluctuating, and then, definitely if you're retaining water, the vascular system, just is not overloaded, but, sometimes, if you retain a lot of water, your doctor may put you on a mild diuretic or a water pill. You pee off the extra fluid and the blood pressure comes down. Somebody asked me a question on the question tab. Doesn't relate necessarily to blood pressure, but I'll answer it. So if your heart is racing for no reason for several seconds, what does it mean? It means you have an arrhythmia or abnormal heart rhythm. Now what's causing it? That's going to take some detective work. So, it could be that the top chambers are beating fast, the atria, so you may have supraventricular tachycardia where the top chambers, fire off some extra beats and your heart rate's, maybe up to, 150, 200 beats a minute. It could be atrial flutter, it could be atrial fibrillation. Those are more common if you're still conscious. If your bottom chamber is beating very fast, you could have, premature ventricular contractions where you're just throwing some early beats, but your heart isn't necessarily going to be fast. If you had ventricular tachycardia or ventricular fibrillation and it doesn't stop, you're going to pass out. And if it doesn't stop, you'll pass away. So you have to know kind of what the person's background is. With their age, if they're older, they're more likely to have an ischemic etiology, a blockage in one of their arteries, starving oxygen and nutrients to the heart, causing the arrhythmia. If you're younger, more likely supraventricular tachycardia and not necessarily as bad. But so a good history and physical from your doctor, and then potentially a Holter monitor where there's different versions of the monitors where it would record your heart rhythm 24 hours a day for how many days, depending on how often you have it. So if you only have the symptoms once a week, they're probably going to put a 7 or 14-day monitor on you. If you have it every single day, maybe they only need a 24 or 48-hour monitor to catch what's going on. It's like you take your car to the mechanic and it's the red light engine is on. If you get to the mechanic and the car's not making the noise anymore, the mechanic's not going to be able to pick up what's going on. So they'll monitor you for as long as it takes to catch what you normally are sensing. And they may or may not recommend an echocardiogram, an ultrasound of your heart to see if your heart is structurally normal. If you have a weakened heart or an abnormality with your valves, that potentially could drive some of the drive some of the rhythm issues if you have mitral valve prolapse. And then they may check some blood work, thyroid function, electrolytes, and then I check inflammatory markers, vitamin D, look at a couple other things that might drive the palpitations or the arrhythmia. So, any feedback tonight, any topics you want me to hit in upcoming weeks, just drop them in the comments or send me a direct message. This video will be up on Instagram TV when we're done chatting tonight. I had recorded a IG interview a couple of weeks ago with Viva Rays talking about blue blocking glasses. I thought I had a technical difficulty and I thought the video got eaten by the machines, but ended up finding a backup copy of it in the archives. So I'll post that up on my story in a day or two. So if you want to learn more about blue blocking glasses and the health benefits of those, I'll have that up there. Good question. I didn't go there tonight. I've talked about that previously in my 24-hour glucose monitor. But the connection between insulin and blood pressure, yes, if you're insulin resistant, you're pre-diabetic, you're diabetic, you're definitely going to have effects on your blood pressure. If you have a lot of inflammation, high sensitivity CRP is elevated, you have low vitamin D, all those things are having an effect on blood pressure. So hyperinsulinism and anemia or high insulin levels affect the receptors to the kidneys that sense blood pressure. So that's in one of the cases where potentially some people end up on blood pressure medicines while they're trying to fix the insulin resistance. If you fix the insulin resistance, the prediabetes, goes back to normal. They have normal glycemia, normal insulin levels. Their blood pressure improves. They don't need medications. You treat the root cause, treat the insulin and the glucose issues. All right, everybody. Well, thank you for your attention tonight. Great questions as always. I'll be back next Monday night, 6 o'clock Central Time. Don't have a topic yet. I'll think of one, or if you guys send me a request, I'll probably let it percolate to the top of what I'm going to do. But at some point, I'm going to have probably either next week or the week after that, I'll just have an open Ask Me Anything, and we'll go over any cardiovascular or biohacking topics you want to learn about. So thanks for joining tonight, and we'll see you next week.